Hi, everyone. We're just going to wait till more people join in and we'll get started soon. For those that are here, I am going to put a survey in the chat box if you want to take some time to answer the survey. And the question we have before we start is, what do you think data sovereignty is? So if you just open up your chat box, it should pop up on the right-hand side. And if you can answer that, if you don't know, don't worry. We always tell people just try to guess the best. And one of the ways someone said at one of our last sessions was like, oh, I'll break it down. I'll do what data is and I'll do what sovereignty is. So we'll wait for more people to join in. And we'll get started pretty soon. But in the chat box, you'll notice that there's a question for you to answer. It asks, what is data sovereignty? So if you want to start taking time to fill that out. So if you're just joining, in the chat box, we do have a question we'd like you to answer. It just asks, what do you think data sovereignty is? If you want to take about a minute or a few seconds to do it, that would be great. And we'll get started in the next few seconds. I'll put the chat box again. I'll put the question just in case we have new people that joined in. And you'll notice, okay. All right, then sounds good. What I'm going to do is I'm going to just pop up. It is, okay, I'll fix that. 1 second. So if you're joining in, I'm going to be putting in, it should be enabled, but I'm hoping to put in a chat box. And if not, we could send it out. All right.
Should I start sharing screen?
Yeah. Oh, okay. All right. So go ahead, Stephanie. All right. So welcome. So we are coming in from Treaty 1 territory here in the Manitoba region. It is home to 5 First Nations groups. We have the Anishinaabe, the Cree, Anishinaabe, Dakota, and Dene. And it is also the homeland, our birthplace of the Métis Nation. So welcome to our webinar. And we are from the First Nations Health and Social Secretariat in Manitoba. We'll be doing a series of webinars over the next few months until September. And our hope is to offer webinars that have been identified through community and other organizations and entities that we've worked with. So in our webinar series for May, we do have Data 101, which is Basics of Data with Dr. Jill Warwick. And at the end of this, we will send the information out. We also do have OCAP and ethical principles in June. In August, we will have a webinar on how to set up a research governance committee for your community or organization. And in September, we will have a webinar on telling your story through data. For the month of July, we are going to take a break for that month as we're presenting at a conference during that time. So you'll notice you have a Q&A question. If you have any questions during the session, please type them in the Q&A box and we'll get Dr. Stephanie to share. But I'll introduce myself quickly before I turn it over to Stephanie.
I need to be able to, I can't share my screen.
Okay, all right. And then so this is, so my name is Carla Cochran. I am from Fish River Cree Nation, and I also have roots in Saugeen First Nation. So I work in the area of data sovereignty and I work with FINISM. And I've been doing this work for the last how many years. But we do have my colleague here who just got her PhD, and I want to recognize that because that's a very awesome, amazing thing that we're so excited. So this is Dr. Stephanie Sinclair, and I'll let Stephanie introduce herself.
Hi, good afternoon. My name is Stephanie Sinclair. My family is from Sandy Bay and Peguis First Nation. I grew up in Winnipeg. I've been working at the First Nation Health and Social Secretariat since it started, and previously to that, I worked at the Assembly of Manitoba Chiefs in the health unit. So it's been a long time that I've been working in this area, and I'm really pleased to be here today to share some information about our latest project.
All right, Stephanie. So the way we're going to do it is I'm going to ask Stephanie questions about data sovereignty. So we'll get right into it. So Stephanie, what is data sovereignty?
Oh, sorry.
And
First, I
actually,
was wanted.
and who's the team? And who's the team
Yeah,
actually?
so
Yeah.
this is our team. So this myself and Carla, but we also have a bunch of other people that um, work with us and have contributed to developing this PowerPoint that we're going to share with you today. We are looking for an administrative assistant. The job posting will be going out soon. So if you know anyone that's available that are interested, we would love to have them. So I also just wanted to share about our organization in case people are not familiar with FNISM. The First Nation Health and Social Secretariat of Manitoba was mandated to serve all 63 First Nations by the Chiefs and Assembly. Our goal is to serve the First Nations individually, collectively, and regionally, working on areas of health and social to improve well-being in Manitoba. So to answer Carla's first question, she asked, this quote is from Gwen Phillips from BC, one of the BC nations, and she's a board member of the FNIGC, the First Nation Information Governance Center. This matters to Canada because, like all governments cannot be successful if their rights to self-determination and self-governance are not empowered by the governance of their own data. So First Nations have the right for sovereignty that has been provided by our relationship to the land and water that we have come from. It's also recognized overall in the Canadian Constitution, which recognizes and affirms inherent and treaty rights of First Nations. So it is part of the structure of Canada that we should have access and be able to govern our own affairs with data that is usable. For Manitoba, we've come up with this vision to share with you today. So we honor and protect our sacred responsibility to gather, analyze, interpret, and share our stories in accordance with our nationhood, past, present, and future. And the mission of what we're trying to do is to capture, protect, and share our stories in accordance with our own worldviews as self-determining nations by our people, our keepers, our storytellers, and our interpreters.
So I do have a question for you. If you want to explain a little bit more about why data sovereignty is important.
Yeah, so this kind of explains a little bit, but one of them is the goal of data sovereignty that we're trying to achieve through this project, and we've been working on it for over 30 years, is to have every First Nation in Manitoba own, use, and store their own information, and then they would share their information with us at the region so we could advocate or put reports together that showcase our region of Manitoba and all the things that are happening within the First Nations. But they would have their own data that the data would be the strongest at the community level, and then they would share it with us. And then every First Nation would have their own ethical review body for research, which would ensure that their community and their community members are protected when they are engaging with researchers, so that everything is done in a good way and that they know where the information will be stored and how it will be used and who will have access to it. We also want to promote that First Nations are applying and leading for their own research projects and their own projects of evaluation to look at what's working and what's not working in their communities. And then First Nations are using the data to make decisions and to share information with their community about the health status or the wellness within their own communities. So to answer Carla's question about why it's important, data sovereignty is important because we, as First Nations, have always done research. We've always searched for understanding, ways of being and knowing in the world around us. In order to survive, we just didn't call it research. So this is a quote from former Chief Norman Bone. Some of the other reasons why it's important for us to work in this area is that we need to tell our own stories and realities, and we can't if we remain hidden in data. So a lot of times there is research done that includes us all together and doesn't break out the groups of First Nation, Inuit, and Métis. So it hides our realities within that data set, or it doesn't break down the groupings in terms of communities or nations, which really would provide more usable information for communities and nations to advocate for their own resources in certain areas. And also we are wanting to promote that we have our own measures of and standards of well-being, because lots of research uses Western standards and Western tools, which doesn't actually capture a lot of the things we're trying to measure. And then also we need to include the unique histories, realities, and jurisdictional challenges that we have in Manitoba due to colonial policies and systems that still exist, and also to really capture the understanding of a certain research topic by really having First Nations involved in the research so they can explain the context in which things they're finding are occurring.
So I know often you get asked, what is data? Can you explain a little bit more about what types of data you're talking about or what it is?
Sure. So this is a slide that the teams put together based on some of our engagement sessions of what data is. Like there is, of course, research data, which is what we've originally set out to kind of look at. But there's also administrative data. So every time you use your health card or you interact with any kind of system, the education system, the justice system, there's data that's being captured. That includes demographic, employment status. There's ancestral remains and ancient DNA. So that's coming forward because of the unmarked graves that are being found at previous Indian residential school sites. There's archival material that exists within universities and museums that communities might want to repatriate back to their communities and house it within their own territory. There's community stories and history. There's First Nation knowledge and practices. There's also looking at the genealogy to trace back identity and different things like that. And then there's also biological samples and the resource and environmental samples. So these are all kind of different types of data that is related to health and health research. There's way more data that you could probably add to this, but this is just the starting point from what we've been discussing with communities so far.
So just based on that data, what is important to take into consideration when working with data and working with communities?
I think it's important to remember that data is not just numbers. Has a spiritual aspect to it. It is our truths, our stories, our loved ones, our communities, and our ancestors' knowledge that we're sharing. So it really needs to be cared for in that manner. And that relationship is really important to be able to have a trusting relationship and be upfront and open about what the data is going to be used for, who's going to have access to it, how it's going to be governed, and really lay out how the First Nations will be leading or be involved in sharing that information. So I think there just needs to be a lot more care and respect and really focus on developing a meaningful and long-term relationship. It shouldn't be just like a one and done kind of project. A lot of times research can be in and out without having a longer lasting impact or sharing that information back to the communities in a way that they can use it. So those are things we're trying to work on with data sovereignty and within the research unit at BNSM.
So looking at the national scope, what's the connection between data sovereignty and across Turtle Islands?
So yeah, I'm as I mentioned before, we've been working on it for over 30 years, but within the last year, we were able to get funding from the First Nation Information Governance Center through their data sovereignty strategy. So there's 10 regions across Canada that are working on implementing this plan, looking at these different areas outlined below. We are working together to write proposal to submit to Treasury Board that will outline what a regional information governance center will look like for our region. And these other centers these other areas here are also working similarly. The goal is not for everyone to have the exact same blueprint of a center, but to have a center that meets the needs of their region, the First Nations in their region. And then that these regional information governance centers can also be connected and work together on certain areas to share data or to house data or to share best practices. So that's the goal of what we're working on nationally. And these are our partners that we're working with across Canada to do this work. This is an infographic from one of our first meetings where we were sharing about some of our goals in Manitoba and some of the things that we would like to do in Manitoba in this area.
That was what I was going to ask, was in the Manitoba region, what is happening with data sovereignty?
Yeah, so this slide is an update kind of the things that we're doing in Manitoba to develop our proposal and our regional information governance center. So of course, we start off with we're talking directly to communities, engagement sessions to find out what data communities currently have access to, what information gaps are out there, and also what's their priority for the information that they would like to see coming back to their communities that they might not have access to now. We're also doing demonstration projects. So we're working directly with communities on projects that they've identified as important that have to do with data and data sovereignty. So I'll speak a little bit more about some of those examples in a few minutes. We're also working on training and education. So that was one of the things that came out of both the engagement session and the demonstration projects is there needs to be more training on how to govern data, how to keep it safe, and what are some ways in which to analyze and use that information and share that information back. Like developing infographics, posters, those types of things. We also found that through this work, there is a need to develop a human resource campaign. So there's not a lot of people that are in the field of data in all the different areas. So we really wanted to try to connect with youth and people that are in university now and see if there's an interest in connecting them to the work we're doing and hopefully training some people that would be future leaders of this work. And one of the other things that communities have brought forward was an archive and history center that maybe every community would want to have that and have some of their stuff repatriated back to the community so that they could share and own that history within their community. So we're learning more about that as we're going. So overall, we're trying to we have a team that's working with communities and partners to determine what's needed in the region to have a data sovereignty regional information governance center and to build our blueprint of what that's going to look like.
I do have a question because I know I wanted to ask you about the examples of data and where they live. And I do have a question that connects with this. I'll ask after you share a little bit about this.
Yeah, so one of the things we also did was to kind of scan and see where our First Nation data is right now, where there is being data kept about First Nation. So we know there's regional data that's kept through Manitoba Health and different surveillance system. We know there's national data through different surveys. There's the regional health survey. There's data that we have collected through our partnership with the First Nation Information Governance Center of surveys that have been developed specifically by First Nations for First Nations. And then there's also community-based data. There's a lot of data that's in the communities that they have housed there that they really want to have access and be able to connect those different data sources together to create a fuller picture. So those are some of the areas and ways in which where data lives about First Nations.
So there was a question that said, just said, thank you for the session. Has the group considered and working on classifying their data, such as restricted, protected, and public classifications?
No, we have not. I think that is part of what we would be doing as we're determining what the priority is. Also looking at what the if the data is suitable and usable, because I know some data that's being used for research right now might not be the best source of data, and there's a lot of maybe gaps, or the data wasn't collected with free, prior, informed consent. Things like that that we really do need to consider. We're also talking about the archive data. There's a whole different kind of way in which they classify data. So that's another thing we're learning about as well. So thank you for the question. Yeah, Carla will keep an eye on the chat. I can't see anybody. I can only see my screen. So Carla will let me know if there's questions or comments, but we do have some time at the end for that as well.
For sure. And then, so you mentioned engagement sessions earlier. What have you learned so far with the engagement sessions, and what types of engagement sessions have you done?
Sure. This is kind of our summary slide of the engagement sessions we've done so far. So when we first started out, we really wanted to talk to those groups that sometimes might not be included in different research projects as a focus. So we talked to youth, urban, First Nations, knowledge keepers, LGBTQ+. So we talked to them first to find out what, as I mentioned earlier, what is the data that's available that they have access to? What are some gaps in the data? What are some things that they would like to have access to in order to improve their health and wellness? Then we started talking to we talked within our own FNISM team, as well as health directors. So the health directors of the 63 First Nations, we've had a session with them and then another session. So all of these groups we've talked to, we've had initial sessions, and we send the information back from each report to all those that were in attendance, if they wanted to change anything, add anything, take anything out. And then we're rolling all that information up into one report that's kind of going to inform our proposal going forward, saying these are some of the needs, these are what's wanted in our region. So we've also been directed into certain areas to do more specific engagement sessions. So we've done one on mental health, we've done Head Start and daycare directors and early learning. And we've been also asked to do some future sessions. We would like to connect with federal and provincial governments to see how we can work together on data sovereignty and what would be some priorities that they would like us to share and work on. Tribal councils, and we've also been connected with specific other groups such as CFS and Jordan's Principle that are interested in doing a session or some training. So some of the things that have come out through these sessions is the data needs. So we've kind of classified the information. This is just preliminary analysis for our data needs, data topics, and the uses of the information. So the first one, data needs, includes access. So having access to all the information that's required. So sometimes the communities don't have access to information that they need, whether that be to provide health services or to understand if there's an outbreak in their community. Having fast and usable data that's like at their fingertips is the goal, and of what people would want in order to be able to do their jobs, as well as ensure that their communities are healthy and promote wellness. There's training that's required to govern, to access the data, to analyze the data, to also put together reports or findings. There's a wide range of training that people have identified as something that they would like us to work on with them. Development of policies and procedures around data, and technology. There's a huge gap in technology, especially in having a usable database that can be interoperable and connect with other sources of data. So those are some of the data needs. The data topics that I've mentioned a few of them, but there's different topics on identity, how to identify people within the data. So there's different ways. And then also cultural identity, so traditional practices. And then there's Western measures that have been used. So what can we do to replace those Western measures with something that fits more within our context and can actually provide us with some information that if a program is working or not based on our own definition of what wellness is. Specific health priorities. So we know mental health and addictions is is a priority, as well as chronic disease within our communities. So having more data on those types of things. Social services, so being able to evaluate and connect those types of data with health data was another area. And uses, so the uses that they want the data for are to advocate for equitable care at a regional and national level, repatriate care closer to home or within communities, program and health planning, so knowing the numbers of children that are being born into the community can help planning all the way up for health and social and educational goals. Research and knowledge translation, so there's a lot of uses that communities want this information for, and what we're going to work with them on.
So I do have a question for you, because we do have two comments.
Okay.
I'll read those at the end, but the question is, how do your strategies action plans differ for working towards on-reserve versus off-reserve data sovereignty? Is one more doable in the short term, or are they both being worked towards concurrently?
Yeah, they're both being worked towards concurrently, I would say. Like there is because people don't live just in one community that like they're born into and they live there, they move around. So some are in the urban centers, some are living in communities that they're not actually registered to. So there's a lot of different complexities within the data sovereignty. So it's really defining for each nation what they want to include in their data sovereignty. Do they want to include everybody within? So these are some of the questions that have come up when we're doing the demonstration projects. Is like, who is included in our community? Does it include everyone who lives in our community, whether or not they're from there or not? And do we include urban members of our community in the sample, or in what we're planning for? So those are some of the questions that we're working with the communities, and they're leading the way in terms of what they decide in who is included and who is not included within their samples and their data sovereignty strategies. Hopefully that kind of answers your question. It's complex either way, I would say. So, and we're working on both.
And I know I have one more question, but it does connect with the demonstration projects,
Sure.
but the previous slides. What is repatriation of data, and can you give an example?
So repatriation of data would be if there was data sets that we had access to. So for example, we had done a community profile report for each community based on the data sets we had access to at MCHP. We created a data report for each individual community, and we sent that back to the community so they could use it. That would be one example. Another example would be if the university had artifacts or stories or recordings from a specific community, that could be returned to the community, and they would be having the ownership and governance over it. So those are some examples of repatriation. There's a lot of different ways that could look. That would be one thing I was gonna say as a takeaway for government researchers, academic institutions, is what is the process, or at least to start to think about a process to repatriate data so that First Nations can own, access, and use that information. But yeah. So I'll move on to talk a little bit further about our demonstration projects. We have about 10 demonstration projects. So these came about by communities reaching out to us after we presented or engaged with them through different areas. And they have a specific project that they want to work on with data and data sovereignty, and it relates to data sovereignty. We'll work with them to identify, kind of like scoping out what does that project entail, what kind of help can we provide. And we're really doing this in order to figure out what this Regional Information Governance Center can provide to communities for support. What kind of staff do we need there? What kind of resources do we need? What kind of supports and ongoing training is going to be needed? So these are the three things that why we're doing the demonstration projects: to identify what is collected, identify what the community wants to repatriate, the cost, so to assess the costs required for First Nation communities to access, collect, store, and govern their data. Support, what supports has the community identified in this area, and development, to develop the Regional Information Governance Center to really meet the needs of the First Nations here in Manitoba, which will look different than the Regional Information Governance Centers in other parts of Canada. So we really wanted to be focused and grounded in what's going to work in our region. To further talk about the demonstration project, these are some of the themes that have come from the 10 projects. So some are looking at culture and history specifically. Others want to work on infrastructure and technologies, like I mentioned, the databases and the interoperability. Others want to look at education and training. So they want education and training on how to develop their own governance structures or how to analyze information they already have. And of course, most of them are focused on health. So this is just an example of some of the different types of projects we're working on. So I mentioned data analysis, IT support. So we're working with our own IT team within Finism to help us with that piece. Grant or proposal writing support, building relationships with different institutions like University, Manitoba Archives, training community members in analysis, data collection, the creation of tools that they could collect, First Nation specific privacy protocols, assisting in writing information sharing agreements and data sharing agreements. So those are just a couple examples of different things that communities wanted to assistance with working on, and it really helps us to kind of flush out and think about how can we support communities in a good way, so that they're the ones leading the project and we're just supporting and creating more opportunities within the community for people to learn and take those leadership roles and move forward. We don't want to be like long-term partners with the community in terms of, always being the one to write proposals, but training people and working with people to assist them in doing that. And the communities already have all the ideas, and as you can see, all the things that they want to do. There's a vast majority, and this is only a sample with 10 projects that we're working on right now.
So, you talked about data sovereignty and the work that the team is doing. Can you give us some other examples of what you've worked with data sovereignty and you plan to continue to work with?
Sure. So this is an example of, I mentioned earlier with some of the issues with using Western measures. So this is a project that I was involved in. It was called Supporting the Trajectory of Our Spirit. It was a partnership between Cree and Blackfoot communities in Alberta and Cree communities in Manitoba. So it looked at supporting the trajectories of children born with the assistance of an Indigenous birth helper or doula, and having that access to the spiritual way of life from birth. And the research question was looking at how does that impact their health and wellness across the lifespan. So through this project, there was the realization that Western measures were not going to be able to, capture the essence of what this Indigenous birth helper and having spiritual and cultural supports from birth was doing, within the families and for the baby. So there was a need to develop our own kind of wellness indicators. What does wellness mean from a community perspective? So that was done in this area, and we've shared this work through the data sovereignty, and there's interest in other communities to develop their own wellness indicators, realizing that, some of the gaps that have been identified include the impact of land-based learning, the impact of language, the impact of ceremony and cultural healing and knowledge. So this is something that could be included if you were to develop their own wellness indicators. And also there is unique factors to each community, things that have disrupted wellness that might also be wanting to be included in these indicators. If they had, for example, a hydro dam built in their community, or they were relocated, or they, so there's a lot of different things that could have happened that could have also been an interruption to wellness. So those are having your own wellness indicators is kind of an option that allows you to really customize and work with what's in your community and what's it'll be more meaningful, I think, and the results will be used more by community members if it's developed by them.
I do have one quick question. At the
Sure.
national level, what funding currently exists to support data sovereignty?
At the national level, right now, we have funding for 3 years to develop this proposal, and then it will go back to the to Treasury Board for a full submission to hopefully have to establish these centers as permanent. Because right now we're we have a center, but it's all pieced together through like research projects, grants, things that we get from FNIGC, things that we have going on within our own, where we're able to get funding together. So this is the opportunity to actually work on something that we can create something more permanent for communities. Let's see. This is another area that we've been working on. So and in a way, I guess that kind of demonstrates how data sovereignty can impact First Nation communities. So we have the COVID-19 special project. So we had a PCRT. Did I say it right?
PRCT.
PRCT. I got
Yeah.
mixed up again.
So yeah.
So the pandemic response team that was created when the pandemic hit in Manitoba, because there was a need to act. There was a need to protect communities, and there was a need to have a strategy in place. And the First Nations took the leadership role in doing that, as well as in negotiating to have data access to. They wanted to know how many of our members, whether they're urban or not, were getting COVID. How many were getting vaccinated? What was the results? Like, were they getting more sick or less sick? So based on all that information, we were able to have that vaccine age lowered so people could get vaccinated earlier. So there's a lot of lessons to be learned from the leadership role that First Nations took in response to the COVID-19 pandemic. So we have our project now that we're working on is to archive that, to create an archive of what happened, what were the results. So they're doing a scan of all the data that was shared. There was a lot of data that was collected and shared. We had weekly updates on Facebook Live. They had reports. Carla was heavily involved in that work as well, as a lot of the nurses at FNISM. So that's one of the projects, is to have that housed somewhere so that if there is a similar event, we can learn from what happened in the COVID-19 response. And we're also evaluating the pandemic response team. So there was a pandemic response team created by the First Nation organizations, which had various different tables. There was like CFS, there was domestic violence, mental health, the vaccines. There was all these different tables with leads from different organizations and all working together. So they want to evaluate that. How did that work? What are some lessons learned? What are some things that are still happening because of this response team that was established? And then we're also working to keep that enhanced data access. So not just looking at COVID, but looking at other things that can be managed in public health, and how do we keep that data still current and accessible and reporting to First Nations on a regular basis. So those are some of the things that can be done that really have an impact using data sovereignty as the basis. Another area, is my thing working here? Here we are. Another area that we're working on. So we do have a Research Information Governance Committee, HERC, that looks at research at the regional level, which I'll talk a little bit about in the next couple of slides. But some of the areas that are kind of may need more protocols or consideration, because it is a different type of research, is biobanking. So just come up with looking at how you can have an ethical framework that respects the cultural protocols of First Nations when they do collect biological samples. And so we've been working with knowledge keepers and our Health Information Research Governance Committee to kind of develop what can those protocols, how can we enhance the protocols that currently exist for research. So we have 4 protocols right now, but how can we enhance it so that it works for biobanking research as well as clinical trials. So they're working on also developing some guidelines and expectations for First Nation involvement in clinical trials, piloting trials across First Nation, Inuit, and Métis communities. So those are two ongoing projects where we're looking at how this can be accessed and ensure that First Nations are involved if they want to be involved, but they're also protected and there's safe and ethical guidelines that can be given to researchers to say, this is what if you want to get engaged with First Nation, these are the protocols that you need to follow.
I do have one question before we move on and talk about what's needed for respectful research relationships. Is that there is a movement in Manitoba to create the MMI WG2S plus database. Any advice to those who are planning to implement these databases in other provinces in a good way? And can you speak upon that, I guess that.
Yeah, I would say like we have been connected with the people that are going to be leading that work in Manitoba. And we have been, we're going to be setting up a training session for them to go through these 4 principles that are on the screen right now as a starting point, right? That might also be another area where there needs to be further consideration for the ethics and the safety and the care of the families that are involved that have been impacted. That may not all be covered through these 4 principles. So as new research areas and new priorities emerge, like I think another one that's also emerging is artificial intelligence. We might have to adapt and move and grow with what's happening in our current context. So that is what we are working on as well. So if those things if we're invited to participate in those tables and to share what we have, we would welcome opportunities to like provide training, to provide any information, to use what we have already and further develop it to make it make sense for whatever area that is the priority that's emerging. So I could just go through these briefly. They'll be probably covered in every every webinar that we do, but these 4 priorities have been approved by the 63 Manitoba First Nation leadership as our research criteria. So of course, the first one is free, prior, informed consent, and that includes individual consent, but also community consent. So if we're starting a research project with a community, we as FNISM would most likely start by engaging with the health director if it's a health project. And then we would work with them to determine what the project parameters are, what would be their benefit for their community, what would they like to see out of that project. And then there would be a band council resolution developed to say this community is interested and wants to consent to be part of this project, or a letter of support saying this project, we want to be involved in this project, or we are a partner in this project. So that comes first, and then the individual consent once you have the consent to go into the community and work with them as a partner. There has to be First Nation benefits. So that can be benefit of the information that comes out is usable and that they would have access to it. They would be able to use it for advocacy, for proposals, for reporting to the community something of interest, but also benefit in terms of having staff, resources for staff, resources for if you want to engage with knowledge keepers, honorariums. It's really important that we don't put a burden on community members by adding to their already big jobs that they already have, by asking them to be part of research projects without providing the resources for them to participate. So I think that's really important, and it needs to be really outlined, I think, in any kind of research project. Of course, the First Nation principles of OCAP, ownership, control, access, and possession of the data. That also needs to go into the informed consent, right? Where is that information going to be housed? Who's going to have access for it? How long is it going to be there? Who's going to have a say in the governance? And then First Nation ethical principles. So this one is also important, that each community is different. And then when you're forming a relationship or you're working with the community, you can't just take what you learned in one and apply it to another. You have to take the time to really build that relationship and find out what are the protocols in your community. How do you engage with the elders? Who should I talk to first? What are the things that we need to do when we do a focus group? How do you run it here? Where is the best place to have it? How do we report back? So those are the types of things that are really individualized to the community and need to be respected in research relationships.
So just thinking about that, can you explain a little bit more about the governance structure in Manitoba and how it connects to data sovereignty?
Sure. So the Health Information Research Governance Committee, HIRC it's called, was started in 1998. So it's been around for a long time. It started with the first regional health survey that was developed for our people by our people to look at health on reserve. And it started and then it's grown, as I mentioned, like these new priorities and these new emerging areas of research or data governance, it's grown along the way as well to the 4 priorities, the 4 principles that I just outlined in the previous slide. So that is basically what HIRC uses. And if you look on our website, there is an application process for researchers who are doing regional research. So HIRC is only mandated to govern research that is regional in scope. So it wouldn't be giving feedback or approvals to individual communities or north or south or tribal council kind of research if you're working with tribal councils, but if your research involves anything that could include the 63 First Nations, so urban research, for example, research with child and family services or education or some type of topic where First Nations would be represented, then they would want to go through HIRC. So I'll just give a little bit of background on HIRC. So the HIRC is made up of Northern and Southern representatives, which includes Tribal Council health directors, First Nation advisor for environment and socioeconomic. So it has expanded to include not just health, but social. For a First Nation director in health, education, or economic development, academic advisor, a knowledge keeper, and a youth. So it also represents all the 5 language groups that are in Manitoba as well. And the role of HIRC is these kind of are the 3 kind of things that they work on. So they provide guidance and advice to researchers to be able to do research within Manitoba that's ethical and they basically protect First Nations and help guide researchers to do it in a good way. So they approve and support research projects. So there is a file that has been created through Manitoba Center for Health Policy with your Manitoba Health Card and your Status Treaty Verification Number card. They link that file and it's called the First Nation file. So if any researcher wants to access that file, they have to go through HIRC in order to get approval to use that information. So there's other areas too where, like as I mentioned, there's like any kind of research with child and family services usually goes through HIRC as well, because we have a high number of First Nation people in that database. They also refer, so if HIRC is not the one to review the proposal because it's First Nation specific, they can refer to the appropriate area or the appropriate person that can help review or ensure that the research is done in a good way.
So I do have a question for you, but I'll wait till just after this next one, because I do have a question first. When thinking of data research and First Nations communities, what are some recommendations for researchers and federal and provincial governments?
Okay. So this is the recommendations for researchers that we have, like recognizing data sovereignty, communities must have ownership, control, access, and possession of their data to make informed decisions. So really, when you're thinking about doing a research project, how are you gonna implement OCAP? And really trying to think about, like we talked about, repatriating that data back to the community so they can have it within their own structures. inclusion of does not equal equity. So there's been a lot of research that's collected or data that's collected that can perpetuate health inequities because it doesn't include that First Nation voice, or sometimes they'll only have one voice at the table and there's not enough and of many, right? So it doesn't come through in terms of like what the outcomes of the research are. Research is have First Nations lead the research as a determinant of health. So having a First Nation person or First Nation group be the lead of the research. We have a lot of First Nation academics now. We have a lot of First Nation people that are have led research and been involved in research for a long time. So there's no reason why First Nation people can't lead the research and make sure it's done in a good way, and also to have it include that history and context. That's really important when you're sharing the information back. And then creating ethical space, including those wellness indicators that have been developed by the community, looking at strength-based and respect for individual and community sovereignty throughout the research project. For governments, I think it's having meaningful partnerships with First Nations and recognize that the leadership that is available and can lead different projects, and also thinking about how you can create those pathways to access data, to repatriate data, to have First Nations govern that data that you already have. So what are some pathways to make it easier for people to even just have their own data? So I think removing those barriers, making it more accessible, creating space for First Nation leadership over data is one of the ways in which governments can assist in this process. And Carla also has that question, so I'm going to be interested to see what the responses are from people.
So I did put that question in the chat box. It says, in your role, how can you support data sovereignty in the work that you're doing? So it's on Menti, so if you want to take a couple minutes just to fill that out. And you'll notice in the chat box as well, we did put some future webinars for the next following upcoming ones. There is a poster for the new one. We do ask in the question afterwards if you want it to be included on that list, and if you wanted to sign up, and we'll send the information to you. When it comes to questions, Stephanie, you do have a question.
Sure.
It says, we also do cultural heritage archaeological work. Are there any plans or projects that relate to those fields? If not, can we talk about this?
Yeah, there is some communities that are interested in that for sure. We're just learning as we're going and exploring that field. We don't have an expert on our team in that area, so our whole team is kind of learning as we're going. We've visited one of the archives. We have another plan to visit another, and we're just learning about the process as we're going, along with the community that's interested in this work. So we definitely love to connect.
So there's another question that says, thank you for the presentation. Canada currently struggles with compiling and analyzing nationwide data in a timely manner because of the decentralized federalist system. How could we ensure that further data decentralization doesn't worsen this issue?
Yeah, I think that's why they're really, the government of Canada is interested in investing in these regional information governance centers, and how can this information be, I guess we're not going to be collecting the same, but how can we coordinate a system for the First Nation data that it could be connected on certain levels? So I think that is one of the goals of why they're funding this work, is that it will be connected in the end somehow. Somehow there will be shared priorities. So all the regions are doing this similar work to what we're doing. We already had a mandate to do data sovereignty work, whereas some other regions might not have had that. So they have to go out and get that mandate first. So that's why we started right with engagement, because we already know we have a mandate, we have HERC set up, which other regions might not have that regional kind of body to look at governing their First Nation data. So I think that's once they're done their engagement sessions, we'll be connecting. We've been connecting with them throughout, but there'll be shared priorities for sure. And that hopefully that will be one of the things that will come out of it, is some kind of a way to share information in a faster way than we do now.
That's what I was going to ask about the resolutions, like the support. How many resolutions do we have approximately to support the data sovereignty work?
I think we have about 6 or 7 resolutions, like starting with the development of HERC all the way through to developing a center.
We do have a couple more questions. Uh,
Sure.
is there any procurement area or data related to data sovereignty?
Not that I'm aware of.
Next one, with growing rate of Inuit population in Manitoba, can you see further collaboration with data holders in order to invest in programs and services for this population?
I'm assuming, yeah, there would be interest in that. Like in the project that we're working on with at the federal level, there is a connection with Inuit and Métis at the national level. So we haven't made those connections. We have at Finisum made connections with MMF and Inuit on certain other projects, but not specifically on this data sovereignty work. So we have connections with them. We know where they're working towards developing their own systems as well. And we want to support each other to say, yeah, they have their own way of doing it. So you need to talk to them. We don't represent Inuit and we don't represent Métis. They have their own governance structure.
Yeah, that's what I was going to ask about the unique relationship with the other Indigenous, for like Métis and Inuit in Manitoba, and how that's structured in Manitoba.
We don't have a formal structure. I think it's just based on relationships from different projects that we've worked on. And we support and promote each other's work for sure.
We did have a question about the webinar. So the webinars are open to anyone to join. Anybody could join from, if you work in government, with organizations, with First Nations communities, you're welcome to come on out. So the webinars that we do have, and they're in the chat box. And if anyone has any more questions, please add. We do have in May, like I mentioned, the Data 101. We do have in June OCAP and ethical principles, which will go more in detail. In August, how to set up a research governance committee, and September, telling your story through data. Stephanie, there was 2 comments. We had one that said Peguis First Nation are creating Indigenous heritage committees for the traditional territories. Archaeology is very colonial, and archaeologists go into the traditional territories without any engagement or consent and collect artifacts and take them out of the territories. They look at them from a Western perspective. This is called epistemic colonization, and we should work together. So that was a comment. Another one was from Thomas Beaudry, who said, I'd like to set up a meeting with you, working with data research project. So I'll send that information. If you can, please send your email. We do have the information up here. You'll notice, so it is Finisum data sovereignty at finisum.com, and the number's there. And I just want to open it up. Go ahead.
I was going to say this email goes to the whole team, like all of our data sovereignty team. So we'll all get the email if you send an email to this. And the reason why we're doing these webinars is to build up, because we want to have a conference. Maybe Carla could talk a bit about the conference plan. Sure.
So 2 things. If you want to go to the next slide here.
Yeah.
And I do have one more question for you, and that will be our last question. But we do have an EB gathering coming up. I did put the registration. It's the end of May. We always host this because it's important to connect with land, and it's important to connect with our traditional ways of healing. So we do an EB, a water gathering. So if anyone is interested, it is open, but registration is needed. It is in the Whiteshell Provincial Park area. We also have a conference that will be coming up in October. And this one will be focused on data sovereignty. So it is going to be our data, our truths, our voice. And first day will be regional based, geared towards the Manitoba region, and workshops. So trying to give those skills and knowledge about this area. The second and third day will be open up to national. So people across Canada can attend. And we will have a call for stories and knowledge. So you might hear it as call for abstracts, but we call it a call for stories and knowledge. We will send that out, and we will send a save the date. So we welcome anyone to take part. It will be here in Treaty 1 territory in Winnipeg. The last question I have for you, Stephanie, is how do you recommend researchers navigate data sets that include pan-Indigenous variables?
Yeah, I think yeah, I don't know if that's really usable anymore for First Nations. So I think even HERC, they don't really approve research that is pan-Indigenous anymore, unless you could separate out the First Nation data. because it's our context and the policies and the practices that impact First Nations are different than what impacts Inuit and Métis. So it's really, the data is not that usable for First Nations. So what is the benefit? So I guess it wouldn't meet that criteria of what is the benefit for First Nations to have pan-Indigenous data. So I'd say, like, if you can't navigate it, I don't know if it's really usable to the First Nations, and it wouldn't meet our criteria of having a benefit for First Nations. Hopefully that answers your question.
All right, so we are at 1 o'clock. We want to thank you so much for joining us. I did put some other items in there, so when you close down, a survey will pop up. If you could please take a couple minutes to fill it out. It just asks about future webinars that you would like to see, or trainings in the area of data sovereignty. Also, the conference email list, if you want to be added to that, and if you also want us to send you information on the upcoming webinars. So thank you, Dr. Stephanie Sinclair, for providing that overview of the Manitoba region. We want to thank everyone who've come out to take part in the webinar. If you have any questions, please reach out. Our email is in the chat box. It is finismdatasovereignty@finism.com. And as mentioned, everyone will get on our team will receive the email. So if you're sending it, if you want copies of the slides, please send us an email and we can send that to you. So with that, we wish you the best today, and take care, and we'll hopefully see you at the next upcoming webinars. Thank you everyone for joining us.